This video is about litter processing. Litter processing normally occurs at less than 3 days of age because processing is less stressful and less painful for the animal. It includes ear notching, clipping the teeth, docking the tail, giving supplemental iron antibiotics, and castration. Some of these practices are done to improve management and organization of the production facility, while others are done for the welfare of the sow and pigs. Remember, during processing, it is important to disinfect instruments between pigs and to process sick litters last to prevent spread of diseases. Identification is necessary to differentiate each pig and to know which litter the pig is from. A pig can be identified by ear notching or tattooing. However, ear notching is more common, and it has the advantage of being inexpensive.
Ear notching uses a V-shaped ear notcher, and a universal ear notching system is followed. With this system, the left ear designates individual piglet number and right ear designates litter number. The numbering system is the same for both ears. The bottom inner section of the ear is designated 1. The bottom outer section is 3. The top inner section is 27. The top outer section is 9. The very tip of the ear is 81. If the number needed is not one of those, then more than one notch is made and the numbers are added. For example, number 11 would have a 9 notch and 2 1 notches. Added together, 9 plus 1 equals 11. Tattooing uses a striker with needles of the tattoo brand on it, and a carbon-based permanent tattoo ink are needed. The ink is usually either black or green. The tattoo can be placed either on the left shoulder or the back of the left ear. The needles on the tattoo strikers should have an ink applied and should be placed to form the identification number. The area to be tattooed is cleaned with alcohol, then the striker is slapped evenly onto the area. The needle should penetrate the skin to apply the ink permanently onto the animal. The needle teeth are clipped to prevent piglets from biting each other or from biting the mother during nursing. There are 8 needle teeth total. A sharp side cutter is used and the piglet is held with a pistol grip. Pistol grip is formed by putting your left thumb in the crease behind the pig's ear and the left index finger in the corner of the mouth behind the teeth. If you are left-handed, then the right hand is used for grip instead. When cutting, be careful not to cut the gums or tongue and be careful to leave a flat edge, not a sharp one, to the remainder of the tooth.
The tail is stalked to prevent tail biting and resulting infections. It can be done with a hot blade or with a disinfected side cutters. The side cutters should be different than the ones used for clipping the needle teeth. About 1 inch of the tail should remain intact to prevent spinal cord injuries. After docking, antiseptic should be applied to the tail to prevent infection. Iron needs to be supplemented because piglets are born anemic and do not receive adequate iron from the sow's milk. 100 to 200 milligrams of iron is supplemented via injection or orally by 3 days of age. Injection is preferred because it is less difficult and less time consuming. The injection is intramuscular shot given near the side of the neck. Antibiotics are supplied to prevent disease. Like iron, it is given through intramuscular injection. The method is the same, but it is important not to mix the antibiotics and iron together. This could cause components of the antibiotics to bind to the iron and make the iron less available to the piglet.
Castration is performed to prevent fort taint, an offensive odor produced when cooking meat from intact males. Physical castration is performed at less than 14 days of age because it would be painful and take longer for healing if done later. Before castration, the piglet should be checked for scrotal hernias or crypt orchid. Scrotal hernias are the result of part of the intestine dropping into the scrotum. Crypt orchid is failure of one or both of the testicles to descend. To perform castration, the piglet is restrained by holding the hind legs with pig's back facing the restrainer and the scrotal and belly area facing out. A hooked blade is used to create a longitudinal incision over the scrotal sac. Then, pressure is applied to the scrotum to pop the testicles out of the incision. The testicles are pulled while twisting to prevent hemorrhaging. The spermatic cord is then severed proximally. The scrotal area should be sprayed with antiseptic to prevent infection. Litter processing is an important part of swine operation facilities. If done correctly and carefully, it will not cause long-term stress to the pig, and all wound should heal fully and quickly. It improves the welfare of sow and pigs through prevention of fighting among litter mates, preventing disease through antibiotics, and supplying nutrients such as iron. It also helps the operation facility through organization, reducing boar taint, and increasing profitability.